Hi, it is absolutely an honor to be joining all of you today. Amazing to see all of these faces from all over the world. I'm going to go ahead and share my screen. So the way we thought we'd run this today, I know there's different variations, is I'm going to share with you a PowerPoint presentation and talk with you a little bit about policy, actually. And then we're going to open it up because really this is all about you, all about your questions, and giving you an opportunity to kind of pick my brain, learn about things that are important to you, and understand health from a different perspective. So I'm going to talk to you about using policy to change populations, not just 1, 2, 20, 30 at a time, but millions at a time, and show you the power of policy. Before I start, though, I wanted to give you a little bit of background about myself, because whenever you hear somebody's perspective, it's always important to understand a little bit about who they are, because who we are shapes the way we share things with the world. So this is who I am. I grew up in the United States in Indiana. This is, I think you can see this pointer over here. Can folks see the pointer? Check, can you?
Yes.
Yeah, all right, okay. So I grew up in Indiana. I have a dinosaur here because dinosaurs were also around at the time. Okay, but maybe not, but it feels like a long time ago that I was in Indiana. I went to college in Indiana at Indiana University, and I majored in journalism and political science. So I wasn't even thinking about health at that time. I was really thinking about global human rights issues and how to think about communicating that with the public. And so after university, I decided to join the Peace Corps because I thought it would be important to understand a little more deeply what was happening in other communities and thinking about how I could serve not only what was happening in the United States, but in other places of the world. And when I came back from the Peace Corps, I realized I didn't want to just talk about what was going on. I wanted to do something about it. So even though, and I will tell you, my skills in communicating became of paramount importance, I decided instead to become a community organizer and started working in communities in the United States. So at that time in the United States, we were really having a lot of problems with big factories and big places of employment shutting down. And when those shut down in a community, people would lose their jobs. And so I would go in and help think about how we could improve the economy and work with the community to help them enact solutions that they were coming up with. But along the way, I started to see this really important intersection between the physical health of our community and the economic health of our community. And I thought the way I want to continue to work in communities and serve is to be from the health side, because I can still impact the economic side if I can focus on health. So that meant I had to go back to school again. So I went back and I had to take all the prerequisites for medical school because I didn't take them in college. And I really enjoyed that. And then I went to medical school. I did my medical residency on the East Coast. And then I went to public health school and got my degree in public health. And then I started again working in communities. And I did that first working at the local level in New York City at the Department of Health. I then went to the CDC and worked in global non-communicable disease. So all of those things, except for infectious, really that are now the leading causes of death in the world, really trying to work with countries around the world and making them build up their resources and capacity to respond to non-communicable diseases. And then I came back to the United States. I worked at the health department in New York City again as a deputy commissioner. And then I went to the California Department of Public Health, where I directed the health department. And that's where I was when COVID broke out. And so it made the whole world, I think, realize how related our health is, both from infectious disease, but also chronic disease, because the people who were really getting sick from the infectious disease, the majority of them had underlying conditions that didn't just happen immediately. They had built up over time. They had heart disease and diabetes and obesity and things that made them very susceptible. And we also saw that very important intersection with the economy. So after my experience at the California Health Department, I realized it was time also to think about an environment where I could start to thread all of these together. And now I'm in a university setting at Hopkins, as you know, but all across I've continued to practice and maintain my clinical skills because medical skills and public health skills are so related. So that's where I got where I am. And now I want to talk about how a career in public health And particularly the way we think about policy has become a very important tool for us to be able to have impact. And I want to talk about why policy is so important, because being healthy can be really hard, right? So if at an individual level, all of you, if you spend your time focusing on having really positive attitudes and beliefs around health, if you build all your skills around health, so you learn how to eat healthy, if you have lots of knowledge, so you know what kinds of foods you need to buy, you know what kind of exercise is good, if you have lots of time on your hands so that you can make time to go exercise and to not eat in fast food restaurants, but cook food at home, and if you have the money to do that, you as an individual may think that you can be healthy. But what's really important is not just that you have those skills, but that the environment around you makes it easy for you to use those skills to make yourself healthy. So over here on the right-hand side, imagine that even if you had a whole lot of money, if the cost of foods were more than that, it wouldn't make any difference because you still wouldn't be able to buy those foods. Even if you knew how to be healthy and to exercise, if you didn't have access to parks and programs in your schools, you wouldn't be able to exercise. So all of those things in the environment around you make it really important for you to be able to be healthy. So that makes us understand that even if you have all of these individual behaviors, they're pushing the ball up the hill, you're not going to be healthy until we make that environment take that hill away, in which case you'll be able to do all of those things. So we decrease the cost of foods, we make exercise available in your neighborhood, we make messages that you're hearing from companies be about encouraging you to do healthy things, and maybe your neighborhoods will be more safe so that you can go play. Those are all really important things. So individuals need to know what to do, but your communities need to really support those behaviors. And that's where policy comes into place. So I also want to emphasize, as I was just saying, your community is important, but we don't all live in the same community. So this is a map of New York City. It doesn't matter if you actually live in New York City or know what New York City looks like, but just so that you know, these are the 5 boroughs of the city. And I want to show you the distribution of things that are relating to health and not being healthy. And so in New York City, when we map some of these variables that describe communities, like the percentage of the community that is non-white, or the percentage of the community that has poor health, we see that when you track those maps, they actually are associated also with higher rates of, for example, here, early heart disease. If you put in other factors that relate to early death, these maps look very much the same. So I want to emphasize here that it's not having a different skin color that makes people in these areas at higher risk. It's many of those things around racism and things that create and define the way people can be healthy in their communities that relates to their skin color. That is the reason that we see this tracking to poor health outcomes. Likewise, when we think about poverty, it's not just the amount of money they have, but the cost of the environment that we have around them that makes not having very much money much more difficult to maintain health. So these are all things that in our community also define not only equity, but how all of us can or can't be healthy. So I'm going to talk about a policy that we designed in New York City to make being healthy easier. So again, it's a policy that thinks about how do we make that community healthy for everyone. And the example I'm going to give you is how we took trans fats out of New York City. So first of all, I want to tell you a little bit about what trans fats are. So I know everybody's looking at this slide now and thinking, yuck, I really don't want to be in chemistry class right now, but I'm going to make this super duper easy. So I want to tell you about what artificial trans fat is. So artificial trans fat is made from a polyunsaturated vegetable oil. And a polyunsaturated vegetable oil is just a vegetable oil that has molecules that have these double bonds in them. And artificial trans fat is made when we hydrogenate healthy vegetable oils and make them saturated, meaning we put hydrogen on them, and it results in a chemical that changes its structure. So we take a vegetable oil, we add hydrogen, and we get partially hydrogenated vegetable oil. This is what it looks like. We take this very healthy oil that has a double bond, and we hydrogenate it. It breaks that bond. And what ends up happening is that this molecule now goes straight, but the double bond stays. Now, we used to think that because the double bond stayed, it would behave very much like the natural oil. And we know that natural vegetable oils can be very healthy for you. In this stage right here, with this very straight molecule, you can imagine those molecules now can stack. And while vegetable oils are typically liquid, right, like fry oils, these new oils that we make become solid, like margarines and stuff. And so they also are much stronger, and they are less likely to be affected by sitting on a shelf for a long time. So they're much more stable. So if you put them in foods, they can be more stable. So there was a time when they thought artificial trans fats could be as healthy for you as vegetable oils, and industry started saying, this is great because we can use these artificial trans fats in all kinds of foods. And that's what they did. So while there's about, back when we started this policy, well, of all of the trans fats in the diets, about a fifth were naturally occurring. So there's a little bit always in meat and dairy products. The vast majority in our diet came from artificial sources. And they were everywhere in our food. They were in cakes and cookies and crackers and pies and breads and household shortening. Remember how I told you that it would make it solid? So Crisco, potato chips and corn chips, they would use it in those because the fry oils could be, they were much more stable as well. French fries, like at McDonald's and other places, have lots of trans fat in them, and then margarines and other spreads. So basically, trans fats were everywhere. So industry saw a really great opportunity to use them. And this happened around in the early 1900s. And then they filled our food supply. And before you knew it, they were hard to avoid. But why did we even care about that? It's because in the 80s and into the 90s, there were studies in the United States that started to come together to actually show that this artificial trans fat that was now throughout our food supply actually increased your risk for heart disease. So the Institute of Medicine, which is now called the National Academy of Medicine, which is one of the premier national science organizations that reviews literature and evidence and puts out recommendations, reviewed all of the information on trans fat in the early 2000s. And they concluded that there's a positive linear trend between trans fatty acid and total and LDL-C concentration, and therefore a increased risk of coronary heart disease. That translates into saying that the more trans fat you eat, the more LDL-C is in your blood. And LDL-C is the bad cholesterol. And with more bad cholesterol, it increases your risk for heart disease. So the more trans fat you eat, the more unhealthy it is. But at that time, they also said, look, there's no upper limits for trans fat in the diet because they're unavoidable in ordinary diets. Now, if you're sitting in a public health department and you're realizing that there's something in the food supply that's across the country, the city, and affecting everybody in your community, and if you're realizing that it's in there, not because it's naturally in the food, but because we're allowing industry to put it into the food, that sets you up to say, hey, what can I do about it? Because we're government too. We may not be federal government, but we're government. We need to protect our citizens. So how can we take this bad trans fat out of the diet to make everyone healthier? So this is what you had to do if you wanted to avoid trans fat prior to January 2006 in the United States. You had to read the back of the ingredients and understand that trans fat was in partially hydrogenated vegetable oil. So see, there's nothing here that says trans fat. You had to already be super activated and knowledgeable about food and what foods are good and bad for you. And then you had to make a decision about whether or not there was a lot of that and you were going to avoid that product. Now, I don't know how many of you read ingredients labels every time you go eat, but I certainly don't have time to do that. So prior to January 2006, I didn't even pay attention to whether or not there were trans fats in my foods. I didn't know how to avoid it. After 2006, though, new regulation went into place that said on the nutrition facts panels how much trans fat was going to be in the product. So if you go to a store and you pick up a package, you all know that now, you can look on there and see how much trans fat is in there. And if you choose to, you can avoid it. So that was a tool that everybody was going to have very soon at that time in 2006 to help them avoid trans fat when they were shopping in grocery stores and buying packaged foods. But there's a really other important place where people eat where that protections didn't exist. And that's when people buy food away from home. So this is a graph that shows the increase in the amount of money that people in the United States spend on food that's prepared away from the home. So across the bottom, you'll see from 1961 all the way up to 2021. And you can see how it changes over time. So in the United States, the expenditures on food is over $2 trillion. Okay, that's a huge amount of money. So the amount of money is not the important thing to focus on. But what is important to focus on is this change in the dark part of this graph and the yellow part of the graph, of the blue and the yellow. And what you'll see is that increasingly the proportion, while people are spending more and more of their money on food, the amount of money that's being spent on food, the proportion of it, that's food that's prepared away from home, food that's prepared by restaurants and in other places, is increasing to over half of all food spent now. So you'll see this amount that's well over $1 trillion is being prepared away from the home. Now, the food that you prepare at home, you typically go to a grocery store and you buy it and it's packaged. But what about when you're in a restaurant? When you're in a restaurant, you have no information about trans fat on the products that you're purchasing. So what we decided was in New York City, we would develop a policy to help reduce exposure to dangerous artificial trans fats when people eat out, because people love to eat out in New York City. So we developed what we thought was an amazing campaign. It was a voluntary campaign asking restaurants to change, and we called it the Trans Fat Education Campaign. We focused on 3 important groups on trying to change their behaviors voluntarily. We focused on consumers, so people who went to restaurants to eat. We focused on restaurants, and we also focused on suppliers. So this is what we did to try to influence them to change their behavior. We sent out health information to thousands and thousands of consumers across New York City. This is one example. It's called the Health Bulletin, telling people and educating them how to eat healthier, telling them to eat less trans fat, and telling them when they go to restaurants to ask the restaurants to prepare food that doesn't contain trans fat. We also had media campaigns, so there was a radio campaign also that reinforced this. So we tried to reach everybody who would be going to restaurants to tell them to do things differently when they were in restaurants. We also reached out to the restaurants. So we worked with restaurant inspectors and we did restaurant trainings and we created materials for all of the restaurants. There were 30,000 licensed food sellers here in New York City. Just in the city alone, 30,000. So we sent them all information that told them how to buy food differently so that they were serving their consumers non-trans fat containing products. And then we reached out to suppliers. We sent over 15,000 letters to suppliers of New York City restaurants. So these are the suppliers that sell foods to the restaurants. We were sending letters out to Montana, anywhere across the United States where we knew that restaurants were purchasing food. And we told those suppliers that in New York City, we were going to ask restaurants to stop buying foods and ingredients with trans fats. And we wanted the suppliers to make sure that they had alternatives available that didn't have trans fats in them. So this was a policy, but it was a voluntary policy to create a change in the restaurants to protect consumers by having restaurants prepared things differently and having suppliers provide restaurants the ingredients they need to do that. So we thought it was fabulous. We did a survey before the campaign of restaurants to see the percentage of restaurants known to be using trans fats in oils and spreads. And so when we did that before our campaign, we found out that 50% of restaurants in New York City were using trans fat containing oils and spreads in what they were producing. So after that wonderful campaign that I showed you, we did that for a year. asking people to voluntarily change, this was the impact. After a year of a voluntary campaign, 51% of restaurants were still known to be using trans fats in oils and spreads. So what we found is that it didn't make a difference, but we tried. But a voluntary approach was not the kind of policy approach to use to get restaurants to change oils and fats. Sometimes voluntary approaches work, but in this case, it didn't. So now we had to stop and take a step back and think, how do we do this now? Because we know that this voluntary approach doesn't work. We know that 8.5 million people that live in New York City could be exposed to trans fats whenever they go out to restaurants to eat. We know that restaurants are an important source of trans fats in the diet. And we're the government, we're the health department. Our responsibility is to help make people healthier. And in New York City, we also license restaurants. So we have a responsibility to make sure that restaurants are healthy places for people to eat. So what did we do? We went and now we've changed the policy from voluntary to a regulation to limit trans fat. So we went to the Board of Health. We made the argument that we just made to you. The Board of Health is the board that oversees regulation in the city for the health department. And we proposed to them a phase out of trans fat over 18 months in restaurants. That was our policy. First taking it out of fry oils and then taking it out of all other foods. This policy would apply to all New York City food outlets that are licensed by the city. That's 30,000 institutions. And then the Board of Health passed it. And so what did we see? So this is the first survey I showed you, 50% before the policy. This is our education campaign. This is voluntary. That was the second survey I showed you. And then over the phase out time of 18 months, we went all the way down to no trans fat being used. Incredible, right? That a policy, a single policy, could have that much effect on an environment that we know was a very important source of trans fat. Now, I'm not going to show you all of the evaluation studies now, but what did happen from this policy that went forward is that immediately other cities and states started looking at this and started introducing very similar policies. At the same time, the federal government in the United States was looking more closely about this, and ultimately they went and regulated in a final ruling in 2015 that trans fats could no longer be used in foods without it being a food additive. And to be a food additive, you have to prove that it's safe. And there was already so much data to show that it wasn't safe. So now in the United States, trans fats are no longer a part of the food supply at large. And then after the FDA got rid of it, so it ruled it in 2015. Now remember, policies take a little bit of time to be implemented because industry has to change the way they're working, which can take a little while, particularly at the national level. By 2018, trans fats were to be eliminated from foods in the United States. And then WHO has now called for the elimination of trans fats in foods by 2023. And as of this last summer, over 44 countries have already taken full steps to remove trans fats from their food supply at large, and multiple other countries around the world are working on it as well. So that's an example of how to make being healthy easier and how to do it in a way that affects everyone, not just one single community, but where everybody can benefit. So that even if you have individual attitudes, beliefs, knowledge, and skills about how you need to be healthy, if your community around you changes the way it's shaped, it makes it much more easy to do that. So now, even if you know, and you do know now, that trans fats are bad for you, it's very easy for you to avoid them because they're no longer in our food supply. And that makes having healthy behaviors much easier. And that's the power of policy. So I'm going to stop there and give you all an opportunity to think about what your questions might be. They may be lots of different things, but I would certainly ask you to think about how can you make your community healthier, and what kinds of policies in your community you might support to make that happen.
Thank you, Dr. Angel, for that wonderful presentation. We know you wanted to reserve time for students' questions. So students, if you have any questions, please use the raise hand feature, and I will call on you based on how you appear on my screen, and we can just put it on the list. And if possible, let us know what grade you're in and where you're from before asking your question.
Okay, perfect. My name is Sarah Hu. I am a rising senior in Minnesota. And thank you for your presentation. It was super helpful to learn about your history because I'm also interested in going to medicine, mainly through med school, but I'm also interested in policy and stuff. So could you tell us how some of the things that you've learned in med school, how you applied that into the things that you did in New York and California?
Yeah. So I will tell you, in med school, I did not learn about trans fats. So med school, particularly in the United States, does not spend a lot of time teaching you about nutrition. That's changing. Some policies are changing to make that more common, but at the time it wasn't the case. So when I finished med school, I went to public health school, as I told you. So I learned a lot about the framing in public health school, about how to think about populations now. But again, I didn't focus on nutrition. So it was when I got to the New York City Health Department, the really important skills that I had that allowed me to think about nutrition as an example was that I now had the scientific skills to be able to review studies, to be able to understand them, to be able to understand which studies are strong studies and studies that you can rely on and which studies may not be. So I had all of that skill set. I also just knew about human health and what makes people healthier or not healthier. I knew, for example, about cholesterol in the blood and the things that made it go up and made it go down. So when I got into this policy-making position, I had all of the skills to be able to apply them to something like trans fat, to be able to think about what a good policy was. So a couple of the things that I thought were most important about policy is, first, understanding the evidence, understanding trends in population. So you want to have an effective approach, an effective intervention. You want to understand that it's going to reach many people. So even if you have a super effective idea, but it's so expensive or it only works in a couple people, it's not worth really trying to invest lots of public dollars in introducing, because it's not going to change the population at large, and you have limited money to try to change population health. So you need evidence. You need to understand that it reaches large populations. You need to understand that you can turn it into policy. So you take the science, and then you have to think about who needs to change if you want to change. And if they need to change, you need to figure out how you can help them. So policies are really about trying to figure out how to make change feasible. So science, thinking about community needs, and then thinking about feasibility. I think those are the three most important things in developing good policy. And if you anchor your work in science and evidence, it becomes much easier to be able to negotiate with different political parties and find consensus and get your policies through.
Hi, Dr. Angel. It was an amazing presentation. My question for you is, you've worked in like the local level, also the national and the global level. I was wondering what are some of the differences and similarities you found working in all three levels, and has that changed? Like, has the impact you've been able to make changed at each of these levels?
Oh, what a great question. It's so interesting too, because it's not a very simple answer. But I would say at the local level, you have to be much more sensitive to individuals. So if you are the kind of person that really likes to work with communities, get to know communities, talk to communities, working at a city level is a really nice place to work because you're very much in touch with the communities themselves. When you go to the state level, you're often working through smaller regional authorities. You might be working with counties, you might be working with cities, but you're working with all of them at once. So the way you approach a state policy, for example, is really trying to think about what's common across all of those places so that you can create something that they can all do. Because communities can be really, really different and their needs can be really different. And your responsibility is always trying to lift up everybody, so to address inequity so that nobody's left behind. but also to develop policies that help move everybody forward as well. So you have to think at the state level, you're thinking much more about where are the similarities amongst all of these groups that I'm working with. And then at the global level, which is really, really exciting. So working with the World Health Organization, or if you're working even like in the Americas, one of the regional offices of the World Health Organization is the Pan American Health Organization. When you're working with organizations that are collections of nations, now each nation is your individual group that you're trying to think about, just the same way you would maybe think about counties at the state level. So now you're trying to figure out across countries that vary economically, that vary culturally, what are some of the similar ways that you can create policy that helps really bring everyone up. I think one of the really wonderful things about working at a global level is that you get to see so many different places doing different things and being successful. So one of the neat things about working at the global level is you're always trying to translate what worked in one country into another country. Or you're thinking, oh, that only works in that country because that country is specifically like this. That won't translate into another country. So it's a lot of creative thinking at all the different levels. But it really, when you think about your own career, it's trying to think about what level you like to work most at. And then my one caveat is, whatever you decide to do now, so you saw my trajectory. So I went from high school to college, I went into political science, I joined the Peace Corps, I then went into medicine, I then went into public health, and now I'm in an academic setting. Is it even, no matter what you decide to do right now, don't worry, don't stress about it, because you can always, there's always somewhere else you can go as your interests change, and they will over your life because you change as a person as you have different experiences too.
Thank you so much, Dr. Angell. I really enjoyed your presentation. So we had a speaker earlier on whose presentation was mostly about nutrition too, and they talked about the evolution of the nutrition label. So my question was, do you think that the current nutrition label is the best we can do in terms of providing nutritious information, or do you think there needs to be add-ons or whatever?
Yeah, so this is a really good question also, because as you saw, trans fat got added just in 2006. So we continue, as the science evolves, what we tell people and how we tell people to behave also evolves over time. So there is always going to be a different way that we might want to talk about the science or translate the science. But the most important thing is that nutrition facts panel can be used for people to empower themselves to make the best decisions for themselves. Now, I think nutrition facts panels are really important for many different reasons. They're important because you as an individual can use them to decide between which product might be used to be healthier. They're also important because for government and for just public health knowledge, when there are nutrition facts panels on all of the foods, we can look at the entire food supply and understand whether that food supply is a food supply that will make us healthier or a food supply that will make us sicker. So there are a lot of uses of a nutrition facts panel. There may be some things that could be changed, and I could spend a long time talking about them. But the one thing that I do think is really important is that consistently we remind ourselves that the power of those nutrition facts panels really is when we use them to change the environment around us. It's so important that we're all activated because we have the knowledge, but if the foods that are available don't change, it doesn't make much of a difference if you're choosing between a 3,000 calorie meal or a 2,999 calorie meal, because neither one of them are good for our health. So the most important thing about it is changing what's available in our communities to make the foods healthier.
So my question is, with your work with the trans fat campaign and other public health campaigns, have you found that incentives tend to be more effective or like disincentives? What influences people's behavior the most?
You know, it varies, and it just depends upon what area you're trying to change in human behavior. And it also varies on how strong those incentives or disincentives are. And then ultimately, the third piece of it is the community. So some communities are very sensitive, for example, to price changes. Other ones may not be. When we look at tobacco, for example, we know that youth are very sensitive to price changes. So if you increase the price of tobacco, of cigarette products, for example, youth will be much more likely to reduce their tobacco intake compared to adults. everybody reduces it. We show in New York City that everybody will reduce their consumption, but youth are much more sensitive. And why would you guess that would be?
I think just that probably you're trying to save money, maybe with purchasing items, and to have to spend extra money for that would not be in your best interest.
So exactly. So if there's a population that has less money, the cost of something will have a greater impact on whether or not they purchase those things. So that's an example of a kind of incentive or disincentive to purchase that product, or incentive to spend your money otherwise, depends on which side of the coin you want to look at, can have a lot of influence. So that's why there's not any simple answer about incentives or disincentives. We do know that when you decrease the barriers to anything, which is an incentive. Remember, I showed you that that graph that showed the environment. When you make that environment less of a barrier, people are much more willing to go there. So when the default choice, or what the choice in front of you is the healthy choice, you're much more likely to make that decision. And so I think whatever it is, whatever behavior you're trying to change, you need to look very closely at the product, the population, and the environment of that population. And those three things together will help you understand whether you want to create incentives or disincentives. In general, there's, I think, a lot more political interest and enthusiasm around incentives. But sometimes incentives just don't work as well, and disincentives are the things that make people healthier in the long run.
Okay, thank you so much.
Hi, thank you so much for your presentation. So you mentioned earlier how you switched from a poli-sci background back to college in med school. And I just wondered, like, what's your biggest takeaway that you got from that transition?
Oh, yeah. So first of all, that transition, it was really important for me. I met one of my friends from the Peace Corps, decided to go back to school to become a doctor. And I didn't even know it was possible. Like, I thought after you finished undergrad, you were pretty much done with your schooling, and maybe you changed careers, but you didn't go back and start undergrad stuff again. Maybe you got a master's or a PhD, but you didn't go back and do undergrad stuff again. That was all done. And my friend decided she wanted to be a doctor, and she went back and took the courses. So first of all, what I learned from that is that talking to people and learning about different paths is really helpful, because they can make you realize things you didn't realize. The other thing that was really important for me was that when I went back to school, I was 28, and I really wanted to be a doctor. I wanted to be a doctor so bad. I took everything so seriously with respect to my studies, and I was so focused that I had a really wonderful time taking all of those pre-med classes. You hear people complaining about them and stuff. I didn't. I loved them. I thought they were amazing, because I knew exactly what I wanted to do. And I had, I had redirected myself to become a doctor. So I was really, really focused. It made it super easy for me to learn. And then when I got to medical school, I was older than, many of the students. I went to the University of California in San Francisco, and that medical school it had more non-traditional, and so I was called a non-traditional student because I didn't go straight through. It had more non-traditional students in it. But one thing I also realized was that because I had gone back and I had taken all that time off, when I went to study, I was incredibly focused in the library. So while everybody else was running around chewing gum and chatting and having fun, I went to the library, I sat down, I was there for 3 hours, and I was out the door, and I went and did something else, because all I did was study. So I was much, much more focused. Now, that doesn't mean going straight through isn't a great idea if that's what you want to do and that's what you want to do. I'm not suggesting that people don't do that. What I'm saying is that later on, as your career interests might change, those are always options. And when you exercise those options, it's not as tough as it was the first time around, because you really, really know what you want to do and you can be focused.
Thank you. We do have a few questions from the chat if you'd like to answer those as well. Our first question is, are there any particular health regulations that you'd like to see implemented on the federal level?
Oh my gosh, there are so many. I think I'll put them into buckets. First of all, what we know is that the inequities that we have in our population, inequities in things that influence health downstream. So difficulties accessing housing, jobs and income, difficulties getting good food, all of those things have very important downstream effects on health. And not only on health, just on our society at large. And we saw this during COVID as well, that it was the communities that were working on the front line that had jobs that were essential, but many of them oftentimes were lower paying, and some did not have the same access or the same opportunities to make decisions differently. There were some people who may not have been as well that may have made different decisions about their jobs if they had had other choices and in life in general. And those choices are really set up quite early. And so I would, the first bucket of policies that I really think are important is for us to look very closely at the policies related to the social determinants of health, to housing, to mass incarceration, to access to internet and broadband, and make sure that all of those things that are tools to be healthier are available to everyone. And then there's a set of policies that I think are really important that are very focused and direct around, for example, nutrition. Like WIC and SNAP, and making sure that foods that are given through supplemental or special programs to help those who don't have as many resources, that those foods that they get are ample and they're nutritious. So there's a set of policies there. And then the other set of policies is around access to healthcare, which is, we know, also a really, really important tool, not only to stay healthy, but when you're not healthy, to get better. And we have such problems for people accessing health insurance. So making access to quality healthcare across the lifespan is something that I also think should be a right, and something that we give that we invest in.
Thank you. We have another question, and we have, would lowering the price of healthier foods make it easier for people to make healthier choices?
Yeah, well, I think it would. I think it was Sonia or whoever brought up the point before about incentives is, I think lowering the price is important, but we also have to understand the community and what that price threshold is. So if you take something that's $5 and you make it $4.50, that still may not make it affordable. So I think lowering the price to levels that are affordable for everyone will make it easier for people to choose those products. But remember, it's not just pricing, right? So if a product is low and not in price and not expensive, but it's on the very bottom shelf when you go into the grocery store, you may not even see it. So placement is a really important point also. So where do we place those foods? So we have to lower the price, and we have to put them in many places at the lower price. We have to make sure that the grocery stores have them. We have to make sure that there aren't food deserts. So we need to think about where are grocery stores in our communities, because we know some communities don't even have access to grocery stores. So placement is really important. And then the third piece that's really important, in addition to price and placement, is promotion. So we need to get that information out there. We need to advertise it. We need to work with private companies and government to make sure that people know that these are healthier products and that they're better products and better choices for all kinds of reasons than other ones. So pricing, placement, and promotion all make a huge difference in creating the likelihood that people will eat healthier. There are other things too, but yep.
Yeah. Thank you. Yes, of course. Another question we have is that someone has seen a lot about Red 40 in their foods on social media and in the news. They want to ask what your professional opinion on Red 40's impact on health was.
I don't have a clear, specific answer to give you, and I don't want to give one. And it's a little bit complicated. So I'm going to not weigh in on just yet. Again, to remind us all, it's about evidence, right? Like that's where we need to think. It's the evidence and feasibility to make changes that's important.
Yeah, I agree. Another question we have is that someone said this summer has been drastically affected by climate change, building on previous years. How have you seen those effects in policymaking? Has it incentivized people to want to follow policies to make themselves and the world healthier? Or is the environmental barrier caused by climate change made it much harder for policy making to make a difference?
Okay, so my first response to that is the same one I had to trans fat, is that there is no barrier to any of us around something that we have created as humans. So climate change is something that we created, and if we made it happen, we can make it unhappen. So it's all about our collective political will. The thing that's challenging about climate change is that climates know no borders. So in July in New York City, I think we had the outside my apartment. I'm sitting in my apartment right now. The skies turned dark and all of the smoke from Canada came to New York City. And so while New York City really wasn't worrying too much about wildfires, because we're not close to where fires happen, we did have to because the smoke still crossed borders. So the challenging part about climate change is that there is no way to create a barrier to protect any of us. That's also an opportunity because that means we're all in this together. All of us have an incentive to change it. So then what do we do to change it? Now, I will share with you my distress that in public health, we haven't been as big a part of the conversation around how to fix our climate as other departments have. So the environmental departments and other agencies, energy, they've been much more engaged and much more aggressive around policy and climate change. So I would say to all of you, I think this is the most important thing that is affecting us in health. And there are huge opportunities in public health to be warriors in figuring out how to shape policies, how to motivate communities, and how to very importantly communicate to people the health impact the climate can have on us, but also how we all as individuals can work to change that, because nobody wants to feel like we don't have any opportunity or power around this. And so there's lots of things that can be done, but there's still lots of work that needs to be done. So what I would say to that, and any of the rest of you, not only the person who asked that question, but any of you that are thinking about the climate, is that that's an important place to work. A really practical example of it is food, right? So we know that our food system, the production of food, is responsible for 30% of greenhouse gases. That means every product you purchase has in some way affected the climate, which also means when we think differently about purchasing foods, we can also help protect the climate. We're all connected in these ways. So if you care about nutrition, there's a climate discussion. If you care about physical exercise, there's a climate discussion. No matter what you care about in health, there is a climate discussion, and we need to start linking those, and you are all going to be a part of creating that change.
Thank you. I think building off of that, someone had a question. So do you think there is a future to GMOs and meat/other food?
So really,
Shape our future, especially considering climate change.
Okay, so this is not a straightforward question, because the way that we produce food has to be looked at in many different ways. So we know, for example, the Lancet report on the EAT report. So it focused on the global food supply and what was a diet that all of us as humans should be eating that would also be good for our planet. And one thing that they recommended was decreasing the amount of meat that we eat, which makes a lot of sense. But at the same time, we replace that with something else. So if we replace one thing in our diet with something else that produces just as much greenhouse gases in its production, maybe it's not meat, but maybe it's ultra processed, and the transportation around the world to get to you makes a big imprint, then maybe we're not making the best decision either for our climate. So this is complicated. It's not something that we can't figure out, but there's not one single best answer. So producing foods closer to consumption decreases transportation. That's true. But it also affects other areas of our economy, which ultimately affects our climate too. So these are all things that we are going to be grappling with for a while. But suffice it to say that there are definitely ways that we can change our diet and the way that we produce our foods to have a healthier environment and healthier human health, or human health and planetary health both can benefit, but we have to be very thoughtful about those relationships.
Of course. I think we have a broader question as well. So from your experience, what are some effective strategies for addressing health disparities and promoting health equity on a global scale?
So when we talk about health equity, which means that we're all given the opportunity to have our optimal health, we need to think about all those things that create health. and the things that create health are oftentimes not the things that are most obvious. They're not just what we eat, but they're all those things around that shape the climate that we're in. So remember the slide that I showed you about creating healthier environments. So if we think globally around how to create healthier environments, it means we also have to create environments where more people have the opportunity to be taken out of poverty and to be able to use their own skills to earn an income that can help them have all of the things that they need to be healthy. So we need to think about what our economy is like globally and what the opportunities are for everyone to be healthier. Another very important global conversation is about access to healthcare once again. So even though the decisions about exactly what kind of healthcare delivery system every country has is not made at the global level, global conversations about really trying to think about what it would take to level up access to care is very important as well. So that's another, I think, very critical part of it. And then I would also add this conversation that we're having about climate and environment is also remarkably important in the global conversation, because you can imagine if there is a drought in one part of the world that produces food for much of the rest of the world, then everybody suffers from the cost of food going up to access going down, and that has a ripple effect around the world. So that global climate, that environment that we're in, also is very important to health equity.
Thank you. I think this question's I think we have time for a couple more questions, and I think this would be really important for our students to take away. So what do you believe are some key skills or qualities that are essential for success in the field of public health policy?
Okay, so public health policy is about understanding what people need. So to be successful in developing public health policy, you have to have really good listening skills. You can't make assumptions about what other people need. People who are affected by an issue are best at helping describe the problem and the solution. And I think in policy, when you're in government in particular, your responsibility is to listen and to understand what they need, and then to think about how to shape policies that can help change those conditions. So listening skills are absolutely critical. I think also, because many of you may be thinking about going into policy perhaps through a health field, whether it's medicine or public health, going through that training and learning how to really understand and read studies to understand what the science is really saying is critical. So good policy is anchored in evidence. When things get a little dicey, because they always do in policy making, where somebody's may feel differently about something than somebody else, if you can get everybody to go back to the science and really understand the science, oftentimes you can find a way to bring people together and to find a solution that works for everyone. So the other thing are skills to be able to read and understand studies and speak credibly to the public about what the science says and what we need. Now, I know in this post-COVID world, that can feel a little difficult to work through, because I think the whole conversation around acceptance and the credibility of science has been something that we're all still kind of working through, but it's still and will always be the foundation of really good policy. So understanding what people need, and then understanding how to do studies, and then to read and understand the science. And then the very last thing is really having the willingness to compromise to make sure that policy is feasible. So that's a very murky area, but the reality is, if you develop a policy and it can't be implemented, you have helped nobody. You've done nothing for anyone, because that policy is just not going to be enforceable, and it's going to create a lot of ill will. So that doesn't mean that you have to compromise the integrity of policy. That's not what I'm saying. I'm saying that the integrity of policy relies upon a policy that's developed that actually can be implemented. So really being able to think about what's feasible for change and to build that into your policy. So listening, science, and feasibility is all a part of creating really good policy.
Thank you so much. I think we have time for one last question. So as a leader in public health, what role do you believe students can play in shaping the health of their communities?
Okay. So remember I told you that one of the most important things for policymakers is to hear from people and understand what the problems and issues are. Now, all of you live in a community, you are part of that community, you look around, you see what the problems are, and you also probably have ideas with solutions. So I think part of what you can do is figure out how to communicate those needs effectively to people who are in decision-making positions. Okay, so that's one thing, but don't forget, you all are in decision-making positions too. All of us at every level of our life are in decision-making positions. Our ability to impact or to move things might be a little different, but that doesn't mean any of us still aren't in positions where we can help affect change in our own right. So one is communicating to policy or decision makers what your needs are and what you see the problems are. The second is coming up with solutions and really thinking about what a good thing to do would be, what's feasible in your community and how can you implement them. So all of you are in school. That's an environment that can change too. And in that environment, how can you influence decision makers to make sure that space that you're in most all of the day is a place that's healthy for you and for other people? You can define health in many different ways. It can be mental health, it can be physical health, it can be joy, it can be many different things that lead to a longer and more productive and happier end game, which is what we're all going for, and which is health is part of it. So I think you can do many things where you are every day. And also you're really, really important leaders of the future. And we recognize that for sure. So what you think and want to do counts as important. And I think leaders at all levels want to hear that.
Thank you so much, Dr. Angell. This was an excellent session. It was so nice to have you as part of our program.
It was absolutely my pleasure to join all of you today. Thank you.